International research has consistently identified high rates of suicidal behaviour among LGBTIQA+ populations. In Australia, over 40% of LGBTIQA+ people have considered suicide in the last 12 months. This issue is compounded by reports that only 38% of LGBTIQA+ people aged 14 to 21 who experienced suicidal distress in the last 12 months had accessed professional support because they didn't feel like they needed it, anticipated discrimination, or were not aware that services were available. LGBTIQA+ populations are a priority group within Australia's national suicide prevention plans, alongside Aboriginal and Torres Strait Islander society and culturally and linguistically diverse populations. However, there is little work highlighting the experiences of groups who live at these intersections. For people who embody multiple identities, there can be overlapping and interdependent systems of discrimination or disadvantage. To address the critical gaps in policy and support service provision, researchers from RMIT University and the University of Sydney, with the support of Suicide Prevention Australia's Innovation Grant, partnered with specialist LGBTIQA+ organisations, Switchboard and Roses in the Ocean, to conduct a study and develop training materials that centred lived experience within an intersectional approach. Lived experience research reveals the day-to-day embodiment of suicidal distress and places it in the context of social and emotional relationships, such as this account from a sister girl participant. In emergency, I've seen people go and come in the mental health, and I'm thinking, it's just all temporary, band-aid health. But then they're going to know my story. I'm not going there and tell them. Somebody's going to read my records. Our investigation has gained new insights into the lived experience of suicidal behaviour within LGBTIQA+ communities, including First Nations LGBTIQA+ sister girl and brother boy people and LGBTIQA+ people of colour in Australia, and provided a deeper understanding of the factors that influence and protect against suicidal behaviour among these communities, and the practices and services that were helpful in preventing or managing this behaviour. The full report includes recommendations for setting the policy context, developing appropriate and affirmative support, improving community responses to suicidal distress, knowledge and training, and further research. Supporting these recommendations are the research findings and the lived experiences voices of 20 LGBTQA+ interview participants. You can download the full report via Figshare.